scenario? Let me know in the chat. Did the explanation help? Great, great, great. Okay, Goddess, thank you for letting me know. And let me move on to the next scenario. Okay, here we go. So scenario number 2. So next we are going to review CABG procedure, which is coronary artery bypass graft. So Chorus, how are you or what are your feelings about CABG procedure? Are you good with the guidelines or are you good with CABG procedure coding? Good, great. Let me know so that it'll give me an understanding of how in depth I should explain to you for these scenarios. Okay, good, everyone. It's look like most of the majority of the students are good with the CABG. Some okay, good. Some need more practice. So yes, we are going to do some practice scenario on CABG procedure as well. So let me read the scenario for you all. So your options are option A, 33534 33511 33508 I-25.10 E78.0. Option B, 33534 33518 35500. Option C, 33534 33518 33508. Option D, 33534 33518. Preoperative diagnosis, coronary artery disease, hypercholesterolemia. Postoperative diagnosis, same. Operation, coronary artery bypass graft in ×4. Left internal mammary artery to obtuse marginal artery, right internal mammary artery to left anterior descending artery, reverse saphenous vein to left diagonal artery, reverse saphenous vein graft to right posterior descending artery. Procedure: the patient was brought to the operating room and placed in supine on the operating table. After induction of general endotracheal anesthesia, the patient was and draped in usual sterile fashion. We proceeded to harvest saphenous vein endoscopically from the left lower extremity. At the same time, the lima and rima were harvested by open technique. The pericardium was opened and tacked up to form a cradle. The patient was hypnotized. The conduits were prepared for the bypass. We opened the cardiac cradle, cannulated the ascending aorta and the right atrium. The antegrade and retrograde cardioplegia catheter were placed. At this time, we placed the patient on cardiopulmonary bypass. The targets were examined and they seemed to be graftable. At this point, we placed cross clamp on the ascending aorta and arrested the heart with antegrade and retrograde cardioplegia, topical ice, and the patient was cooled down to 32 degrees Celsius. At this point, we exposed the territory of RPDA. It was found to be modest target, a reverse saphenous vein graft to the right posterior descending artery was fashioned in 7-O proline. The flow was measured at 50 ml per minute. The next, we directed our attention to the Cuffer's diagonal artery. It was also a modest target. It was open. The anastomosis was fashioned using a reverse saphenous vein graft with 7-O proline. The flow was measured at 60 ml per minute. At this point, we exposed the territory of the obtuse marginal. The left internal mammary was prepared. The lima to the obtuse marginal graft was performed with 7-O proline. There was excellent hemostasis. We tracked down the wing of the mammary. The bulldog was placed on the mammary, and at this point we performed 2 proximal iotomies with 4.0 mm aortic punch. 2 proximal anastomosis were fashioned After the veins were cut to the length with 6-O proline, the bulldogs were placed on each of these veins. We revamped the patient. The territory of the left anterior descending artery were exposed. The rema were prepared. They were placed on the rema to the left anterior descending coronary artery. Anastomosis was fashioned using 7-O proline. We resumed perfusion of the heart. We re-aired the root of the aorta and removed the cross clamp. The patient resumed a normal sinus rhythm. The sites were overseen. The vein grafts were de-aired in usual fashion. We examined the proximal and distal anastomosis, and there were excellent hemostasis. 3 Blake drains were placed, 2 into the mediastinum and 1 into the right pleura. We did not enter the left pleural space. The patient was weaned off cardiopulmonary bypass without any difficulty. The sternum was reapproximated with heavy stainless steel wires in a mattress fashion. The instruments counts were correct. The patient was transferred to the SICU in stable condition. So what CPT and ICD codes are reported for this scenario? Beautiful. I can see answers already coming in the chat. Great, great. So Chorus, you got 2.5 minutes more to answer the scenario, and your time starts now. All the best, Chorus. Give your best answers in. Okay, Curtis, that is time. I think I give you a few extra minutes for this scenario, but all of you have given a great answers in the chat. Excellent. So you all are good with the CABG coding. Excellent. Good to know. So let me walk you through this scenario. Let me highlight the keywords. We have a coronary artery disease and hypercholesterolemia as a diagnosis. Uh, Operation performed is coronary artery bypass graft. There were 4 grafts used. One of them was the left anterior mammary artery to obtuse margin artery, right internal mammary artery to left anterior descending artery. We had a reverse saphenous vein to the first diagonal artery, followed by reverse saphenous vein to the right posterior descending artery. So these were all your 4 of the grafts which were used here. Patient was placed in supine position. A general endotracheal anesthesia was given. Saphenous vein endoscopically. Lima and Rima were harvested by open technique. Placed the patient on cardiopulmonary bypass, a reverse saphenous vein graft to the right posterior descending artery, first diagonal artery, Lima to obtuse marginal graft was performed. Rima to left anterior descending coronary artery, anastomosis were fashioned. Patient was weaned off the cardiopulmonary bypass without any difficulty. So these were all about the scenario and the procedure that performed this scenario. And okay, so do you know what a cardio or a CABG procedure is? A CABG procedure, otherwise known as coronary artery bypass grafting, is called a heart bypass surgery. Yes. So it is a medical procedure that will improve the blood flow to your heart, and it may be needed when arteries supplying the blood to the heart, known as coronary arteries, are narrowed or blocked. So in the image over here, you can see the coronary arteries are blocked because of the plaque formation, and this will affect the blood flow to the heart as well. So what that can lead to a heart attack or myocardial infarction, etc. So that's an emergency. That's a very serious condition. So what a doctor or a cardiac surgeon do is that he might perform a cardiopulmonary bypass, CABG procedure, coronary artery bypass procedure, where a graft will be placed in order to bypass this plaque, and that will ensure that the blood flow to the heart is not affected or it's not stopped because of this plaque, right? And we are having another image over here as well, so you can see how the coronary arteries are narrowed and how it is difficult for the blood to flow. So over here, the after image, which shows how the heart will look after the bypass graft. So these are the graft which are placed over here. Yes, so that will ensure the blood flow. And yes, so these graft can be obtained from arteries as well as veins. Okay, so we are having a 4 graft used. We are having a left internal mammary artery to obtuse marginal artery. We have a right internal mammary artery used to the left anterior descending artery. We're having a reverse saphenous vein, which is endoscopically harvested to the first diagonal artery. We have reverse saphenous vein, which is also endoscopically harvested to the right posterior descending artery. Okay, so is that clear, coders? Please let me know the chat. Okay, good. Great. So someone has asked me to show the question. So coders, please you can please feel free to take a screenshot of the question. So I will just hold the screen for a couple of seconds. Please go ahead and take the screenshot if you need to, or if you think like you need to work on it later. Okay. Okay, great. So I believe you have taken the screenshot. So let me move on and let's come back to the coding portion. So as I said, in the procedure inventory, we have 4 graphs used: left internal memory artery, right internal memory artery, reverse saphenous vein, and 2 reverse saphenous vein as well. And the diagnosis inventory, we have coronary artery disease and hypercholesterolemia. And these are all our code options. So we also have our CABG FTRs in the left hand side. So let me review the CABG FTRs for you all. So the first question which we must ask is type of the grafts which has been used. Did we use a veins or arteries as graft? So in our scenario, we had a combination of grafts, which is a combination of artery and veins used. Okay. So next question, number of grafts used. So in our scenario, we have total of 4 grafts used, out of which 2 of them are artery and 2 of them are vein. All harvests are bundled except upper extremity vein, artery, and fembob. Okay. If a combo code is used, code first the arteries, then code the veins from the combined code section. So if there is a combination of arteries and veins used, you must always code first from the artery section. So in the right hand side, you can see we have a section for combined arteriovenous grafting for coronary bypass. We have a section for venous grafting for coronary artery bypass, as well as we have a section for arterial grafting for coronary artery bypass graft. So whenever a combination of an arteries and veins are used, you have to select first the code from artery grafting for coronary artery bypass section, followed by you have to select the venous vein graft code from combined artery and venous grafting code section. Okay, is that clear, coders? Is that concept clear? Because that's very important in coding CABG procedures. Great, awesome. Thank you for letting me know. And last but not the least, the FTR is endoscopic harvest are coded separately. Okay, so now let's go ahead and let's start solving this scenario. So we have option D, which is coding for 33534, and 33534 describes coronary artery bypass using arterial graft to coronary artery graft. Okay, so this is a good code selection because it follows our guideline, because we had a combination of arteries and veins here. So we have to first code from artery code section. Yeah, we have to code from artery grafting for coronary artery bypass section first. So yes, we had 2 arteries. So 33534 is a good code selection. Let's move on and look into the next code, 33518. The 33518 is also coding for, it's also a good code selection. It is coding for coronary artery bypass using venous and arterial graft to venous graft. Okay, so this one is also following the guideline we just mentioned, but still option D is incorrect because it is not coding for an endoscopic harvest, and we had 2 veins which were harvested by endoscopic approach, right? Yes, and the FTR also states that endoscopic harvests are coded separate. So option D is not coding for endoscopic harvest, and that is why option D is incorrect. Now let's look into the next code option, option A, that is coding for 33434, which is correct code option, and next 33511. 33511 would be incorrect because it's not following the guideline or FTR for a combination of arteries and veins used. So as I mentioned before, if a combo code is used, we have to first code from artery code section, followed by venous graft from combined arteriovenous coding section, and not directly from venous grafting section. So that's why option A is incorrect. Now let's review option B. Option B coding for 33434, which is correct code option, and 33518. 33518 is also a correct code and code selection, and third code is 3335500, which is coding for a harvest of upper extremity vein, one segment of lower extremity, or coronary artery bypass procedure. Okay, coders, let me know. Please let me know, coders, why is option C incorrect? Any guess? Any answers? Let me know in the chat. Okay, I don't see any answers coming in. Okay, so let me explain it for you all. So 35500 is coding for harvest of upper extremity vein, and this is not by an endoscopic procedure. It is by an open procedure. So in the parenthesis just below, it's also mentioned that for endoscopic procedure, you have to use 33508. Moreover, for 35500, it is coding for harvest of upper extremity vein. We had a reverse FNS vein graft used here, and reverse FNS vein graft is not an upper extremity vein. It's a lower extremity vein. So it is incorrect in both ways. So let's look into option C, which is coding for 33534, 33518, and 33508. 33508 is coding for endoscopic surgical, including video-assisted harvest of vein, coronary artery bypass procedure. So yes, that's what happened in our scenario, and the correct answer is going to be option C. So coders, you've been silent in the chat. Let me know, how are you feeling? Did the explanation help?
Thanks for tuning in, and until next time, happy coding!